Hi, this is Khalid Shebani. Please join me on this journey towards healthier you. Together, we will accomplish our ultimate goal, namely an expedient and hassle-free scheduling of your surgery. Please visit us at ShebaniInstitute.com. Who should undergo bariatric surgery? According to the criteria established by the National Institutes of Health, a subdivision of the United States Department of Health and Human Services, any patient with a BMI of 40 kilograms per meter square or higher, or 35 kilograms per meter square with one of the comorbidities such as diabetes, hypertension, sleep apnea, osteoarthritis, or hyperlipidemia is eligible for bariatric surgery. This is not to be confused with the insurance company's requirements to approve the surgery, and we see that often mixed up. How to get started? We need a referral letter from your primary care physician, and then we will arrange an office consultation. During the office consultation, we'll talk about four things: surgical options, what surgery is best for you; insurance requirements will be discussed in detail with the staff; medical testing as required; and medical clearances if and as required. The choice of surgery will depend on the BMI, on the type of obesity, previous abdominal surgery or surgeries, and the general state of health. The insurance company require a letter of medical necessity by your primary care physician, a 6 months documentation of a diet and exercise plan with month by month documentation, with copies of the office visits from your primary care physician, and it has to be 6 consecutive months. Psychological evaluation by a psychologist or a psychiatrist, a nutritional evaluation, a letter by a nutritionist or a dietitian. Medical testing, we require NUMS blood test, complete blood count, comprehensive metabolic panel, thyroid stimulating hormone to check the thyroid function, lipid panel, electrocardiogram, gallbladder ultrasound, chest x-ray, and upper endoscopy or AGD. It has to be performed by me. Any patient with chronic health issues, we will obtain medical clearance accordingly, whether it's cardiac, pulmonary, or hematologic. Our preferred method of payment is self-pay, whether it's cash or credit. No approval or referral are necessary. You simply walk in and the surgery will be scheduled usually within 7 to 14 days of the initial office consultation. We have a competitive and a reasonable fee schedule. It's among the lowest in North America. Nevertheless, the National Institutes of Health criteria for eligibility have to be met. In order to prepare for the surgery, a high protein, low carbohydrate diet should be followed once the surgery date is scheduled. 4 weeks prior to surgery, a high protein liquid diet must be followed to shrink or reduce the size of the liver. Surgery will be simply terminated if the liver is too large and the surgery cannot proceed. 48 hours prior to surgery, a clear liquid diet and 8 hours overnight fast is required. On the day of surgery, you will meet with the anesthesiologist to go over the anesthesia plan. The surgery itself will take between 1 to 4 hours, average usually 2 hours. You'll have a nasogastric tube and a urinary bladder catheter. Both will be removed at 6 a.m. The following day, you'll have a surgical drain, also known as the Jackson-Pratt or the JP drain, on the right side of the upper abdomen that will be removed prior to discharge. On the day following surgery, now it's an upper GI study will be performed in the radiology department to rule out leaks and obstruction. If the study is normal, a clear liquid diet is started, and if the patient tolerates the diet, will be discharged to home and the surgical drain will be removed. The clear liquid diet will be continued for 5 days, and for the first 4 weeks, patient will have a full liquid diet, and followed by another 4 weeks of soft mechanical diet, and on week 9, regular diet will be started, and the goal is to have 60 to 80 grams of protein, a 1200 calorie based diet to be followed lifelong. For the first 3 months, all pills should be crushed or a liquid form medicine is substituted. A lifelong commitment taking supplements such as B12, multivitamins, calcium, and iron. Also, lifelong commitment taking at least 60 to 80 grams per day of protein. And for the first 3 months, a proton pump inhibitor regimen will be started to promote the healing. I hope I was able to shed some light on the approval process of bariatric surgery. In summary, bariatric surgery is covered by all commercial insurances except if the patient has an exclusion. Bariatric surgery is covered by Medicare and Medicaid. The 6 consecutive months of diet and exercise documentation takes the longest to fulfill. Doing that in advance will greatly expedite scheduling the surgery date. For detailed information, please refer to our seminar video in the URL address provided here. Thank you for watching, and I hope you enjoyed this video.